Thank you, Leah. My name is Emily Stewart, and I'm the Chief Curriculum Officer at Aquifer. I'm also an Associate Program Director for the Internal Medicine Residency Program at Dartmouth-Hitchcock Hospital and an adult hospitalist. Our holistic approach to teaching and learning focuses on ensuring health profession students are becoming successful clinicians. We provide clinically relevant learning tools in a manner that supports them where they are in their learning journey. We provide students with clear direction on knowledge gaps and strengths, then give them targeted learning opportunities through Aquifer content, followed by meaningful feedback and effective coaching, all supported by individualized data. We recognize that schools and students feel deeply the pressure of doing well on a standardized exam, and there are many wonderful programs out there to support that aim. But in order to be an excellent clinician, you need more, and you need tools that work together to leverage that understanding when they turn to their all-important test prep material as well. Unlike other e-learning products, Aquifer Cases walk learners comprehensively through each step of a patient encounter, from history, physical, and labs, through developing a differential, ordering additional studies, and forming a differential diagnosis, to treating and managing the patient. Throughout this process, core learning objectives are met through meticulously mapped teaching points, such that by the end of the course, all of the relevant national objectives have been covered. The cases provide in-depth, interactive, and engaging teaching along the way, much as you would expect from an expert preceptor, and ask the students questions to check and correct their knowledge before moving to the next step. Students routinely tell us that there is really nothing else comparable out there to prepare them for success on clinical rotations by providing them with the evidence-based clinical care knowledge that is needed to treat their patients. Aquifer Cases are rich with real multimedia test results, modeled communication, embedded questions, deep dives, and links to references and more. They are peer-reviewed and continually updated by our expert medical educators on our consortium. Many educators think of our cases as a library of high-quality, standardized patients, easily accessible by all faculty and learners that can be used as you deem appropriate across your full curriculum. Programs often tell us students and faculty consider each Aquifer case a realistic substitute for a patient because they provide access to conditions and scenarios that may not be seen on a rotation due to your patient volume, seasonality, geography, or accessibility. We provide a safe space to practice clinical decision-making skills and access to patients in core conditions that students need to see. Aquifer has a library of over 200 cases, including our new neurology course, expanded clinical excellence case sets, and over 40 sciences integrated illness scripts. If your program is a curricular partner, like over half of our subscribers, you have access to our complete content library. Our curriculum covers the national curricula and supports a majority of core clinical rotations, all of which use the same clinical reasoning and pedagogical approach in order to promote consistent and effective cognitive practice within a supporting and safe learning environment. We partner with NYU and the Betty Ford Foundation to provide cases in surgery, readiness for residency, and substance use disorders. Our clinical excellence course has 50 cases on interdisciplinary topics that are historically hard to teach during fast-paced clinical rotations. To address this, we have case sets that focus exclusively on these topics, and we have embedded curricular threads that weave these key interdisciplinary teaching points directly into Aquifer's core cases. This provides just-in-time learning for our students and allows programs to ensure coverage that feels authentic without adding faculty time. With access to both the case sets and the curricular threads, programs have the tools needed for introducing topics for early learners, revisiting key principles during relevant core clerkships, and building advanced electives. Now let's talk about the integrated illness scripts. At Aquifer, we aim to bring down silos between basic science and clinical educators to create powerful tools for teaching and learning clinically relevant core basic sciences. In collaboration with IMC, we have developed a comprehensive national curriculum and over 40 integrated illness scripts focused on the causal mechanisms of disease underlying common clinical conditions to support cognitive integration. The scripts are accompanied by a range of fully developed activities, easy to implement in the classroom or the clinic, to help your students make the needed connections, drive active learning and bedside teaching discussions, and most importantly, improve their clinical decisions. I will now turn it over to my colleague, Anthony Wilson, to discuss our assessment options.
Hi, I'm Anthony Wilson, the Manager of Assessment Operations at Aquifer. In recent years, there has been a shift in the assessment industry toward using assessment to drive learning, instead of merely measuring it. To that end, Aquifer offers several assessment tools. Aquifer on July 1st, 2023, launched our new formative assessment system, Calibrate. This innovative new assessment tool drives self-directed learning, identifying true knowledge gaps by calibrating knowledge and certainty, and uncovers curricular gaps for faculty. We offer Calibrate assessments for family medicine, internal medicine, pediatrics, and radiology, allopathic, and osteopathic schools, as well as nurse practitioner and PA programs. We currently are developing Calibrate assessments for neurology and geriatrics, and we have plans for sciences, women's health, clinical excellence, and other areas. Additionally, a clinical decision-making exam is available for internal medicine and is included with our internal medicine course subscription. The CDME provides the unique ability to assess your students' individual abilities, to apply their knowledge to make the decisions needed to provide quality patient care. The typical evaluations of student clinical decision-making by residents and attendings working with students in a clinical setting are important, but are limited due to the realities of clinical practice. The CDME helps to overcome some of these challenges and provides a way to enhance your understanding of students' skills. Let's take a closer look at Aquifer Calibrate. Calibrate is assessment for learning, as opposed to assessment of learning. Each exam contains 25 to 45 multiple choice questions. Each question includes a certainty rating to calibrate true knowledge gaps. Each question is also mapped to learning objectives and teaching points in Aquifer cases, which cover the national curriculum for STFM, CDIM, COMCEPT, and AER. Also important, Calibrate assessments are easy to administer and do not need to be proctored, easing the burden on programs. Calibrate is designed to be given twice during the clerkship, early and late, which provides checkpoints along the way. Early assessment will identify areas of strength and weaknesses at the start of the rotation, allowing the learner to plan, learn, reassess, and readjust their knowledge base. This is followed by a late assessment to evaluate areas of growth and ongoing weakness, helping to inform and prepare the student for lifelong learning, as well as the end of the clerkship exam. Calibrate reports are a powerful tool to drive self-directed learning for the student. The students get detailed reports that link directly to Aquifer learning objectives, teaching points, body systems, clinical foci, and cases. Faculty and programs receive high-level views of individual student performance and detailed views of cohort performance for curricular planning. Importantly, we don't include question and answer stems in the reports. Real patients don't come with tidy answers, nor do our reports. Rather, students are encouraged to dive into where their understanding is miscalibrated and develop an individualized learning plan, which is embedded in our system, for how they will address their learning gaps. Optionally, they can share reports with a faculty member or coach to inform a meaningful conversation during the clerkship. We also are developing a self-assessment question bank so that students can reassess their knowledge along their learning path. Clinical learning experiences are a valuable commodity. Calibrate empowers students to make the most of their experiences and direct their own learning. For faculty and administrators, Calibrate further supports accreditation standards for mid-clerkship feedback and formative assessment, and aligns faculty and students around a common assessment linked to curricular teaching tools, providing objective data to inform meaningful conversations, identify individual students in need of remediation, and identify curricular gaps for a cohort. In short, by developing Calibrate, we've addressed many challenges you all have by providing a high-quality, nationally developed formative assessment system designed for clinical learning. I'd now like to turn it over to my colleague, Leah Romano.
Hello, everyone. My name is Leah Romano, and I'm a relationship manager here at Aquifer. Today, I'm going to be showing you more about Aqueduct, our teaching and learning platform. Some key topics we're going to cover today are the searchable content library, custom courses, user management, reporting, and our Android and iOS apps. In Aqueduct, faculty and administrative users can look through the content library to familiarize themselves with content. And also, this is a great starting place for when you want to create a custom course. Aqueduct has a searchable content library, and you can access it by clicking the words Content Library in the header. This is available for faculty and administrative users, and it allows you to familiarize yourself with the content that you subscribe to. and then also search and filter by the keyword search or other drop-down menus to then take a look at the content or create your custom course. So we'll just dive in here as an example. I'm typing in diabetes in this example, and automatically the content library changes the results of what's available, and it highlights the number. So now I have 30 matches that I can take a look at. I might also want to use a drop-down menu and say, you know what, I want to focus on emergency medicine or other clinical disciplines to see which cases match those needs. And automatically the matches then change, and you can take a look at another set of cases. If you're interested in adding these cases to create a custom course, on the right-hand side, there's an add button, so you can save them for a custom course for later. I want to highlight that all of these filters and drop-down menus have corresponding color coding tabs in the results. So if you hover over them, you can see that in this example, the emergency department in green is a clinical location. Those in yellow are diagnoses, and a coral color is final diagnosis. And there are other examples that match the filters. Now we also have clinical excellence cases and curricular threads. And you may want to take a look at what those threads correspond to certain cases that are available. Now that I've clicked in this example, diagnostic excellence, we see that the threads appear in the middle of the screen. This one is pink with a star, and that highlights to you the result. You may also want to take a look at which of the cases also correspond with our basic sciences content. We have core concepts and basic science disciplines that you could type in or take a look at. I'll just X out on some of these other searches. Our basic science courses have a slight blue hue as a background, as a visual impact. And you can see that the basic science curricular thread is highlighted with a star in the middle of the tab. And then there are also corresponding purple body systems and then basic science disciplines in teal to help you determine which you'd like to use. You could also at the top show any cases that have summary statements. So Xing out here. I'm going to click this little toggle button on the top left, and it changes the cases and it drops it down that you can see the current number right now is 89. And that corresponds with the cases that ask students within the case to complete a case summary statement. And you will see their responses in a report that we can show later. Additionally, on this page, faculty and administrators can click on the tabs on the right-hand side, such as synopsis and learning objectives. When you do, a pop-up window appears so you can read for more. There's also a button where you can click case summary, and a PDF is available for you to download that corresponds with the case. Now, if you're looking at basic sciences, there's an additional tab that you can take a look at. There's also a synopsis, but the mechanisms of disease map is also a pop-up. As I mentioned before, the content library is a great place for you to start to create a custom course. Whatever you select, and then on the right-hand side, there is a blue add button. Once you click add, and then the button at the top that says create custom course, that's the start of the process of creating the custom course. And we have instructions in our dive in available to go over exactly what you need to do step by step. In Aqueduct, there are a variety of tools that can help you. For faculty and administrators, there's also a wonderful tool called Dive In, making the most of Aquifer. This is your self-directed learning hub. It's in green, and if you click on it, you can see that there are a variety of volumes that you can click for more. There's Aquifer 101 with all the how-tos on how to use Aqueduct. How do I add or remove a user? How do I look at a report? How do I create a custom course and more? It's all listed there with videos and visuals to walk you through so that you have what you need. We also have Aquifer 102, Teaching Effectively with Aquifer. It goes into more detail of what the courses are, what's available. We also have a student experience and orientation that is available for the students, but it's a guide for you as well. It goes into detail about our assessment, as well as other features available. We recommend you take a look. Then lastly, in the dive in, is a chance for you to dive deeper and learn about Aquifer Calibrate, our formative assessment. It's got a great overview, key highlights, and then all the how-tos of how to use it. There's reporting, coaching, and more. We also have a team of experts here at Aquifer who can help. Another great tool that's available that's also connected to the dive in, on the bottom right-hand corner, of every screen is the Need Help button with a question mark. If you were to click on it, there will be a keyword search, some preloaded and curated information based on your user role, as well as a direct link to create a support ticket. And these are great places to go when you're looking for more information. As you can see from the tour, we have a lot of key resources available for you, including the educator resources, the dive-in. Student learning resources are available. We have how-to articles, we have blogs, webinars, podcasts that can be accessed through our educator-to-educator resource directory, peer consultations, and more. They're all available as part of your subscription, and if you have questions, you can certainly reach out to our team. We're happy to help. Here are some ways to create the best student experience, and it's based on feedback from students as well as faculty. We hear from students that they get the best experience from Aquifer when cases are linked to other learning, either related to a patient in clinic, filling a gap in their experience, or as part of a group discussion or class learning activity. We also hear from faculty and preceptors that they're short on time and can't often recommend content to their students. So here are some suggestions. We have a patient library with a corresponding to-do list just for students. We also have self-assessment questions at the end of each case and detailed case summaries when the students finish their case. Now, more details are listed in your dive-in Making the Most of Aquifer tab, but we can go over some of the details here. The searchable patient library allows students the ability to direct their own learning. This is a simplified version of the content library that faculty already use, providing keyword search and filter options with drop-down menus to help find cases to prepare for clinic, brush up on key conditions, and fill gaps in knowledge and experience, just to familiarize oneself with the content, whether assigned or optional. When searching, students will not see the final diagnosis for each case. They can search by patient demographics, clinical location, body system, condition, discipline, and more. There is color coding to match the filters, recommended time, and other tools available to view on this page. They can also create a to-do list from their patient library to save cases to complete later and organize their work. We encourage you to keep this in mind when you're creating case assignments. For example, if your program assigns a lot of cases in bulk, you may want to consider assigning a smaller number of core cases and then allow the students to select the cases that fit their needs and interests. Pair this with Calibrate Formative Assessment to empower your students to direct their own learning using Aquifer's trusted content. Now let's highlight some best practices. Be intentional. Assign cases and incorporate them into your course and clerkship curricula. Select cases with learning goals in mind and consider a summary session to recap and emphasize your intended learning goals. Avoid assigning so many cases that students can't spend enough time with them, and link assigned cases to students' previous learning to ensure they've achieved the learning goals you intended. Know what you assign. Facilitators can make cases come to life when they know the ins and outs of the assigned cases, have a plan for guiding discussion, and can summarize the key learning points. Students value interaction around cases and appreciate facilitators who prompt discussions about what ifs and share their own personal experiences. Link the cases to clinicals. Direct students to the patient library to find specific cases to prep for a patient they will see or learn more about a condition that they encountered in clinic. Cases guide discussions. After students complete a case, discuss it as a group or ask them to bring their questions to clinic. Extend the learning by asking what-if questions to put a different twist on the scenario. For example, what if the patient had this symptom instead? Or what if the test results showed X instead? Plan how you will assign content, how you will assess students, and what progress testing you'll choose. Customize. Explore content that you subscribe to through the searchable content library. Now, this is going to be your best friend. It can familiarize you with the content, and it's a great place to start for creating custom courses. Students have let us know that when they understand the learning expectations and objectives, the Aquifer cases are more helpful to them. Students recommend reiterating that this is a safe space learning environment. It's important to the students also know how to access and utilize the tools in Aqueduct. And finally, how to use Aquifer cases for independent study. Now, to help, Aquifer has created student orientation slides as well as short videos for students. Start with the slides. You can drop them in your course or clerkship orientation or custom course. Watch student videos. When students hear from their peers, they can get a better understanding of how Aquifer cases can help them advance their skills through complete, realistic clinical experiences. Also, share your goals and expectations in your course or clerkship. Orienting your students to your rationale for using the cases in your curriculum is very important. And finally, here are some great tips from fellow educators in regards to a didactic session. Assign Aquifer modules as pre-work. Use MCQs and SAQs as trigger questions to jumpstart didactic discussion. Consider interactive and skill-based activities during didactics. Seek student feedback when making changes to curriculum, and involve advanced trainees and junior faculty to fuel innovation and scholarship. We'd be happy to answer any questions you have or show you more. So up next, we'll now move on to the Q&A.